keep our eye on that. Thank you, Sam. September is Thyroid Cancer Awareness Month, and like other cancers, if it's caught early, it can be treated. Now here to talk about symptoms and treatment is Hartford Healthcare's Dr. Carrie Carsello, an endocrine surgeon at the Hospital of Central Connecticut. Doctor, welcome.
Thank you so much for having me.
Thank you for being here. So first, for those who may not be familiar, where exactly is our thyroid and what does it do?
Sure. So our thyroid gland is here lower in the neck, shaped like a butterfly. I do have a model to represent what it would look like underneath the skin. So the thyroid gland sits right over our airway or our trachea. The thyroid is extremely important. It produces its own hormone, which affects our temperature, our energy, our heart rate, and many other mechanisms within the human body.
Okay, how does someone get thyroid cancer, and are there certain risk factors?
Sure. So thyroid cancer is increasing in incidence. Some of that is due to improved detection as well as just increased incidence of the disease. It does affect women more frequently than men. And often the risk factors that we associate with thyroid cancer are either family history or exposure to high doses of radiation.
Okay, and tell us about the signs and symptoms and how people can self-screen for thyroid cancer.
Sure. So essentially the symptoms that an individual may notice on their own is they may actually feel a lump or detect some swelling here lower in the neck. We do recommend that you do see your primary care physician to get an annual physical, and they should be doing a neck exam as well. Some other subtle symptoms that one may experience would be like a dry cough that's unexplained by other medical problems, difficulty with swallowing, and sometimes some voice changes.
Okay, let's talk about how thyroid cancer is diagnosed and what are the treatments?
Sure. So again, evaluation by your primary care physician initially, and if there's felt to be a mass or a nodule, typically the individual will undergo an ultrasound, and then we do have a classification system, and based on that, then we would biopsy or do an aspiration if the nodule was concerning. Treatment depends on the type of cancer. There are different types of thyroid cancer that we see. The most common type is referred to as papillary thyroid cancer, and the initial treatment usually will entail a component of surgery. Sometimes people need to be supplemented with thyroid hormone, and then in certain individuals they may also get radioactive iodine treatment.
All right, Dr. Carrie Carsello, thank you so much for bringing us up to date on thyroid issues, thyroid cancer, and treatment. Good information.
Thank you very much.